No, regulators will solve all the problems. As it was pointed out by the CEO of Pfizer, it's a highly regulated industry. So whether everything that happens is around, policy, health regulation, and this discussion now is been going on forever, and it will continue forever. It's a moving target. There are two major underlying trends. One is we live longer, and thank God to technology. Every 10 years, we gain 1 year of life expectancy. We have an aging population that will be consuming more and more of healthcare resources. And on the other hand, we have the technology sector. It's not only about pharmaceuticals, medical devices, equipment. Lots of different technologies are coming now to change the landscape, and that's for a good reason. So this is putting a lot of stress on the economics of all countries. Regardless of where you go, there is a major issue how to fund healthcare, how to use these funds efficiently, and how to allocate the funds in a way that will maximize return on investment for the people. And as far as I'm concerned, when it comes to pharmaceuticals, which is the topic of today's debate, there are three major pillars which must be really designed well and regulated well. One is the financing, how you should be financing, what sort of resources you should be directing to healthcare and pharmaceuticals. The second is pricing and reimbursement, what we call access to the people. And the third very important issue is how you use the technology in the healthcare system in a way that is efficient, is maximizing outcome for the investment it takes place. And in that light, I will share with you a couple of thoughts and stress some of the things that Marios said before. First of all, when it comes to financing, Greece is coming out of an era of economic crisis. You've been here before in this event. You've been discussing the financial issue. I think that, as it was pointed out, the healthcare system and the pharmaceuticals are underfinanced. The government needs to think again how they will put resources to direct them to healthcare and pharmaceuticals. And also there is an imbalance between public and private financing in Greece, so this needs to be corrected because it creates equity issues. And things like, horizon scanning, the government and the healthcare system needs to know, what's coming out there, how they're going to find ways earlier on to finance new innovation, what's going to be the budget for the next few years, and how it's going to be split in between public and private sector. So that's another one area that the government is working and the ministry is working, and it needs to improve further. The other one is pricing and investment. So Greece has an external price reference system. That's why it's relying a lot on health technology assessment. And as it was pointed out, some of the things that prevail from previous decade they need to be abolished. For instance, the reference to 5 other countries. Once something is reimbursed in 5 other countries, then it actually can be reimbursed here. That needs to be abolished. Since we have an organization now, an HTA, the government has started a huge initiative on HTA. There is a European also initiative which we can rely on it. So some of these delay factors can be taken out of the system. And I must say, as far as health technology assessment is concerned as well, there needs to be a reward for value. Right now, there is no reward for value. There is a technology assessment, but then the manufacturers, they have to start giving extra rebates and discount on top of what is being given already. So basically, this is not really an environment where innovation, better outcomes are being rewarded, and this needs to be reconsidered. And the final thing is how we use technology. Utilization has a great impact on health outcomes as well as on the economics of the system. And as it was pointed out by the previous speaker, we need to be holistic. We need to understand that pharmaceuticals are part of the healthcare delivery equation. There are many areas where we can deliver efficiency by better using of resources and better use of pharmaceuticals. And so basically, we need to use all the data that the system is generating. We need to be innovative in the way we organize healthcare and basically collect the data. And as it was pointed out by the minister, reward better outcomes by introducing outcome-based agreements, risk-sharing agreements into the system so that we direct the money where we get better outcomes. The government and the minister is working in the last couple of years in that direction, and I'm sure that they will accelerate this effort and they will deliver more value for money and better access to innovation in Greece.